Megan from Aspire Health and Rehabilitation. I'm going to be showing you a taping technique with Rocktape or K-tape that will help when you have some bruising and swelling. So whether you've just rolled your ankle and your ankle's blown up, or you've got a tear in a ligament or a muscle, or post-surgical, anything like that, a jellyfish pattern tape is essentially, it actually helps with the bruising and swelling. So when you apply the tape, it will be in like a crisscross kind of pattern. The jellyfish, because the legs of the jellyfish, and I'll go through how to prep the tape and things like that. But essentially, you can do it for any area of the body, whether it's the ankle, if you've had a calf tear, knee, thigh, elbow, whatever the case is. Essentially, you're going to be applying it in a crisscross pattern, and essentially with the tape, it helps lift up the skin from the tape to help with the fluid. So the inflammation and thing that will be in that area, it can help reduce that swelling and bruising in that area. So what I'm going to do, depending on if you've got the 10 centimeter tape or the 5 centimeter tape, essentially you're just going to be cutting a length of tape. Now with the tape, usually with Rocktape and K-tape, you want to put it on a bit of a stretch. Rocktape stretches about 180%. You don't need that for this kind of taping. So essentially you're only going to be doing maybe a 10, 20, 30% stretch. So you don't need a great deal bigger of tape. So if I was going to be doing my knee, essentially if I was going to be doing it from here to here, you just want a little bit of a short of the tape. Okay. It's a lot easier with the big tape to do this, but essentially I'm just going to be cutting 3 strips down in the middle. That will act as my jellyfish legs. And again, you want about the last 2 to 3 centimeters of tape not on stretch, so I'm not actually going to be cutting up into that area. Okay, and I'm also going to be rounding off the edges so it won't get caught on any clothing. I'll just prep 2 pieces because essentially, like I said, you do want it on a crisscross pattern. Usually with the big tape, you might only have to apply it twice. But with the smaller tape, you could apply it 2, 3, 4 times depending on how big the area is. But for this kind of purposes, I'm only going to be doing it twice. So again, 2 or 3 centimeters from the top of the tape that you don't want to cut. That will be what's called your anchorage point. And again, I'm just going to cut the edges off, just it doesn't get caught on the clothing. So something like with a knee, depending on if you've, for example, total knee replacement or anything like that. Once the wound's healed and don't have to worry about the wound, you can help with the swelling and the bruising. Or if you've had a meniscus damage or a ligament injury, whatever the case is, depending on what area you need taped. For example, I'm just going to focus on the inside, but essentially the knee might be the whole knee. So you might need to apply a few strips of this. Essentially, I'll be starting up at one point. Okay. Again, that's not on stretch, that's just the anchorage. You'll pull a little bit of the tape off. Again, holding about a centimeter or 2, a little bit of a stretch, only pulled it about 10-20%, and you're just laying it down flat. Okay, again, holding about 1 or 2 centimeters, a little bit of a stretch, and I'm just laying it out like a fan pattern, so it ends up being like a jellyfish. If you really want to make it fancy and you're taping it yourself or your child, you can put cut out some eyes in it or something to make it a little bit more interesting, or draw some eyes on it. Again, 10-20% stretch. You're just laying it down like that. You then grab your other one, and you will want to have it as a crisscrossing pattern. For example, if I was doing it from this point of in areas like the lower limbs, everything tracks down. So any swelling or bruising that you have, sometimes it will track down. So sometimes you can get a bit of, even with knee damage, you can also get a bit of swelling in the calf or anything like that with the ankle too. So it depends on where it is. But essentially, you can apply this taping technique to any part of your body. Again, 10-20% stretch, laying down the last 1-2 centimeters without stretch. I'm just crisscrossing it over, laying it out and fanning it out. I find, like I said, I do find it a lot easier using the big tape, but not everywhere sells it, and it depends on what you have. Okay, voila, jellyfish pattern. Okay, so like I said, you whatever area of the body that you have it, you essentially just crossing it over like such, and it helps lift up the skin and helps with the inflammation and the fluid that you have underneath that area. You know, so after it, you can, with Rocktape or K-tape, you can leave it up onto 3 or 4 days. With the tape, when you're showering, you're just patting it dry. And when you do take the tape off, you will notice the difference in regards to discoloration and things like that, and it will help with the swelling. And like I said, you can apply it to any area of your body. With the taping, the reason why I have the 2-3 centimeters or 1 and 2 centimeters down here without stretch is if you apply stretch to all parts of the tape, it can have a little bit of skin irritation, and that's just providing a bit of an anchorage point. If you do have any skin irritations like redness, itchiness, anything like that that indicates a skin irritation, just take it off straight away. Don't try and hold it out for the 3 or 4 days, but you can leave it on for 3 or 4 days. Okay, and you can apply it for anywhere in the body. Thanks for watching. If you want any more access to other videos and articles, check out our Aspire Health and Rehabilitation YouTube page. We also have a website, www.aspirehealthrehab.com.au, and you can also give us a like on Facebook and Instagram.